Good morning, dear colleagues. Now we start our lecture. Раз, два, три. Good morning, dear colleagues. Today we will discuss about anxiety syndromes. I am Professor Alexander Dvirsky. Anxiety. Anxiety, it's what does mean anxiety? Anxiety, it's a complex feelings which include worry, fear, very often accompanied with pulmonary, cardiac, and other physical sensations. I pay attention. Now anxiety, it's a psychological process, yes, but anxiety consists of two parts. From psychological process, it's a psychological part of anxiety. It's like a fear, worry feelings, and behavior. What has been behavior? Behavior is something which we can register. Yes, what we can register? Pulmonary syndromes we can register, cardiac syndromes we can register heart rate, we can register breathing and other physical sensations. If something we can register, it's a behavior. Internal feelings like a worry, it's a, yes, of course, it's a mental process. What does mean mental process? Mental process, it's a background of our behavior. But what's interesting in anxiety? Some part of behavior like problems with heart rate, some somatic or physical sensations developing involuntary. It means patients don't understand why change heart rate. Patients don't understand why why changing breathings. Why it's happy? It's happy because present anxiety. Today we discuss only about anxiety and anxiety syndromes. I pay attention. Today we don't speak about diseases. We speak only about anxiety. Anxiety is a syndromes which present. Sometimes it's a syndromes. Sometimes it's a normal conditions. Anxiety very often accompany different diseases, not only in psychiatry. I pay your attention and repeat once more. What has been mental diseases? Mental diseases, it's a disturbance in behavior and in mental process without general medical conditions. What has been anxiety disorders? Anxiety disorders, it's a anxiety without general medical conditions, without external event, without general medical conditions which can develop these feelings. This picture explains in what situation developing anxiety. In general, anxiety, it's a normal conditions. In general, it's a normal conditions. We feel anxiety every day. When we feel anxiety in the time between we understand our need and time when we satisfy or frustrate our motivations. What example of anxiety? Very good example of anxiety. It's you are before important exam. You has exam after very brief time, for example, after 20 minutes, after 1 hour, and you sit down near exam rooms and you don't know exam. You don't know result, I'm sorry. Maybe you receive a positive marks and your life change in the positive side. Maybe you receive a negative marks and all your plan, all your motivations be destroyed, and you worry. Feelings feelings and psychological and physiological feelings which you feel before exam, it's anxiety. It's a classic anxiety syndromes. Yes, of course, it's a normal conditions. It's a normal conditions because exam very important for you. What does mean anxiety disorders? Same feelings patient has without external factors. Anything happy around patients, but patients has a feelings like you are before exam. I hope now you understand what has been anxiety feelings and what patients feel every time, every day without external event. Anxiety syndromes consist of three main clusters. Yeah, it's autonomous nervous systems A and S, autonomous nervous symptoms. Everything which can develop autonomous nervous systems like sympathetic or parasympathetic, we can add it in anxiety syndromes. For example, heart rate, sweatness, breathings, maybe I don't know, tremor, gastrointestinal feelings, trillings in extremities, everything which manage our autonomous nervous systems. Second groups of symptoms, it's worry feelings. Worry feelings, it's a special psychological feelings, it's a special psychological conditions, yeah? And yes, of course, it's a psychology. Now I split psychology, worry feelings, and body feelings. It's very important. It's very important because body feelings we can recognize sometimes like symptoms, because worry feelings usual patient has before important event when patient waits something. But in anxiety syndromes, autonomous nervous symptoms developing without external events. Only brain starts the symptoms. It's a pathology. Why it's a pathology? It's a pathology because stressor absent but anxiety present, motivation absent but anxiety present, and problems in cognition, in attention. In next slides we discuss about all of these symptoms and explain this picture. What is phobia or anxiety? Look to this picture. Normal, we has a stressor. What does mean stressor? It's a something change. It's a some changings in the environment. To stress, to the changings, we reply. And in normal conditions, low stressors, low reality, low level of dangerous, low reply. High level of high stressor, high reply. In reply, I mean anxiety. I mean a psychological expression of worry feelings. I mean physiological feelings which accompany worry feelings. It's a anxiety in general. Yes, it's a psychology. It's a problems and conditions. Maybe you remember. Sometimes in exam you don't understand. You like something stupid. Why it's happy? It's happy because anxiety influence to your cognitions. But what has been anxiety or phobia? It's a second part. Yeah, low stressors but very high expressions. Moderate or low stressor developing very high expression. In normal, it's a line. High stressor, high reply. But in anxiety disorders, low stressor or absent stressor developing a very high reply in patient's body. What has been anxiety? First, it's a normal unconditioned reaction to stress. It's a normality. It's our reply to stressor. In anxiety, we mobilize our body to struggle with problems which provide environment. But what has been anxiety disorders? Anxiety disorders, it's conditions like we're ready to the fight or flight reactions, but without external stimuli. Main pattern of behavior which we have, it's a fight or flight. It's a fight or flight. Run or attack. Run or attack. It's a very fossil pattern of behavior. Very fossil pattern of behavior. It's a reptile pattern of behavior. But you remember that in our brain we have very large anatomical structure which has a name, middle brain. And middle brain, has other name. It's a reptile brain. Yes, of course, very large part of our brain. It's a reptile. Why reptile? Because reptile has memory. Reptile has emotions. Without emotions, impossible anxiety. Because anxiety, it's a kind of emotions. Yes, of course, we has a two main part of emotions. It's a positive and negative emotions. Positive emotions, it's something which it's a special condition of body when we feel positive, when we feel something positive. Yes, we like positive emotions. And what does it mean? Our life. Our life, it's a surviving. Our life, it's an attraction to the positive emotions. Other side of our life, it's we run away from problems and we run away from negative emotions. Positive and negative emotions, we feel like body conditions. Okay, now I hope you understand. Anxiety, it's a normal conditions, but sometimes anxiety persists permanently, and when anxiety persists permanently, or if anxiety when expression of anxiety incompatibility with level of dangerous, it's a pathology. Symptoms of anxiety disorders. In general, we have two large group symptoms of anxiety disorders. It's the autonomic nerve systems and it's a cognitive and behavioral group of symptoms. Now we will discuss about autonomic nerve symptoms. Autonomic nerve systems. What's expression has anxiety feelings, anxiety disorders. It's a diarrhea, dizziness, hyperhidrosis, hyperreflexia, hypertensions, palpitations, mydriasis, restlessness, syncope, tachycardia, trillings in extremities, tremor, upset stomachs, urinary frequency. Now, pay attention to these symptoms. For example, patient has a diarrhea, upset stomach, gastrointestinal distress. Yes, of course, this patient looks like a patient with gastrointestinal disorders. As example, patient has a dizziness, patient has a mydriasis, yes, and patient has maybe tremor. This patient looks like a patient with neurological diseases. As example, as a group of symptoms, patient has a tachycardia, palpitations, syncope, tachycardia. This patient looks like a patient with cardiovascular diseases. And last example, urinary frequency and, for example, syncope. Yes, of course, like these patients. I'm sorry. Now I switch off my phone. Я потом вам перезвоню, я сейчас занят. I'm sorry, now we continue our lecture. Automatic nerve attack. And now you understand. Then anxiety syndromes can has appearance like usual somatic disorders. Yeah, what's different between anxiety syndromes and somatic diseases? General medical conditions. I pay your attention. If patient has these symptoms which you see in your picture without somatic expression, without general medical conditions, it's anxiety disorders. If patient has the syndrome due general medical conditions like problems with heart rate, we see objective like changes in the electrocardiography, and we see other changes in patients. When we see other changes in the patients, analysis like increased level of the thyroid hormones, some problems, gastrointestinal problems in the endoscopy. Yes, of course, it's not anxiety disorders. But if we see like these symptoms without general medical conditions, it's anxiety disorders. Next group of symptoms, it's cognitive and psychological symptoms. First, it's thinking. What does mean thinking? Thinking, it's the ability of the manipulations with mental object. Thinking, it's a background of our cognitions. Thinking, it's process in which we categorizing and reasoning. Yes, of course, if we have impairment in this mental process, we decrease general cognitive ability. General cognitive ability influence to our everyday living. Yes, of course, in anxiety disorders, it's not a dementia. It's not a dramatic changings of the mental ability. Patient has abstract thinking. Patient has a lot of other ability like reading, writing, reasoning, categorizing, but ability is something decreasing, and it's happy long time. It's not one day problems. It's a problems during the some days. It's a problems maybe the some years, 10 years, 5 years. And yes, of course, every day patient do small mistakes, and after some times it's dramatically influenced to the patient social economics level. Perception. Perception, it's not a delusion and hallucinations. No, it's some problems in understanding of reality, because perception, it's a cognitive process. It's a cognitive process when we're recognizing image, when we are categorizing image, when we understand nature and location of image. Perception possible without sensations. We can something dreaming, it's a perception. And yes, of course, it's a perception, it's a part of cognitive process. Now you understand. Cognitions decreasing, problems in perceptions present too. It's like feedback problems. Learning, problems in it's problems with learning. It's not dramatically problems with learning like in dementia. No, it's like we have 5 mark students. Now the students receive 4 and 3 marks, and he do everything. So with he spent much more energy for do everything. It's clear. It's a difficult do every day. Problems in anxiety disorders, it's a problems in everyday livings. It's not a problems like due dementia, but it's a dramatically decreased quality of life. Next, problems in attention. Very often patients has complaints to the memory in anxiety disorders. But usual anxiety disorders, it's people's with young age. In young age people's usual absent problems with memory. When you meet a young age person or adult person with memory problems, think about anxiety. Anxiety and think about attention. Very often it's a problems in attention. What does mean attention? Attention is ability to concentrate consciousness to the one object. It may be something in environment, it may be something in our mind. Okay, now we discuss about groups of symptoms which depend anxiety disorders. It's a panic attack, it's an agoraphobia, it's a phobia, it's an obsession, it's a compulsion. I'm sorry, now I stand up, go out and come back, okay? Okay, I'm come back. Now we speak about panic attack. I pay attention. Panic attack, it's not a panic disorder. So what does mean panic attack? First, you must understand what's common in all syndromes which we discuss right now. These syndromes include, like a main part, like a favorite expression, it's anxiety. What does mean anxiety? I repeat once more. It's autonomous nerve symptoms. It's worry feelings. It's cognitive symptoms. Autonomous nerve symptoms. It's a tachycardia. It's a sweatness. It's a tremor. It's problems in stomach. It's drilling in extremities. It's problems in breath. It's mydriasis. A lot of symptoms which are very distressed for patients. It's symptoms very distressed for patients. It means patients feel himself like a person which with normal diseases, because a lot of diseases has same symptoms, has the same symptoms. It's maybe cardiovascular disease, gastrointestinal diseases. Second, it's cognitive feelings. Cognitive feelings. It's fear. What's different between fear and anxiety? Fear, it's something concrete present right now, and we have a fear against something. It's maybe near the 100% something happy. It's something dangerous, and our body prepared to the fight or flight. We're ready to struggle or we're ready to run away. What has been anxiety? Stimulus absent, but body ready to fight or fly. And I repeat once more: all symptoms which will be discussed right now, it's symptoms which include anxiety syndromes, like a favorite symptoms. What does mean panic attack? Panic attack, it's a short period of fear. It's a psychological component, yes. It's feelings of derealizations. It's a feelings of lose control. It's feelings of death due cardiovascular problems. Why it's happy? It's happy because patient has serious problems with cardiovascular systems, tachycardia, sweatness, problems with breathing. Patient recognize these syndromes, these conditions, like serious problems with health, like stroke, like some serious problems with cardiovascular systems. Because sometimes patient has problems with motion. Sometimes patient has restless. He try run away. He don't understand what's happy around him. Why it's happy? Why he don't understand? Problems with attention. Problems with perceptions. A lot of problems around patients, and patients recognize patient has a very distressed. These syndromes very distressed for patients. What's essential about panic attack? Panic attack, it's a syndromes which can starting in every time, everywhere, and without external stimuli. I pay attention. Panic attack, it's something without external symptoms. Panic attack starting in any time, in any place. For example, in home, in municipal transport, in class, in cafe, on the street, when patient alone, when patients walk with somebody, in family environment, in office environment, every time. It's very important diagnostic criteria. Very important. Next, for patients, it's a real symptoms. Dear colleagues, I ask you, remember, anxiety disorders, yes, of course, it's a mental diseases. It's a mental. What does mean mental disease? It's problems in behavior. It's problems in mental process without general medical conditions. General medical conditions absent, but for patients, it's a real symptoms. Because what does it mean in reality? Reality, it's some process in our mind. It's a problems. It's a process in our brain. It's activity of neurons. Yes, of course. Panic attack, it's activity of neuron. Yes, of course. Correct answer, yes. If this activity of neurons, it's a part of the patient's reality. Because pain, it's activity of neurons. Clear? It's activity of neurons. Fear, it's activity of neurons. And patient has negative feelings with external influence, without metabolic process, without decreased level of sugar, without increased level of thyroid hormone. But for patients, it's a real problem. For patients, it's a real, very distressed syndromes. What's different between panic attack and panic disorders? Panic disorders, it's diseases which depend a repetitive panic attack without general medical conditions. Clear? For example, if patient has a panic attack and he has a increased level of the thyroid hormones, it's not a panic disorders. Clear? Panic disorders, it's a repetitive panic attack, maybe 4, maybe 5 during the month without general medical conditions. Next syndromes, it's agoraphobia. Yes, of course, it's anxiety syndromes. What has been anxiety? It's been present cognitive and autonomous nervous systems component. What psychological component? It's a fear. What's different? Fear in the special place. In what place? In the public place. You remember in panic attack, it's a anxiety. It's a very strong, very, very high anxiety in area of say so. It's in area of without connections with place and time. And agoraphobia, it's like a panic attack, but only in the special place. In what place? In public place. It's like a supermarket. It's like an airport. Sometimes agoraphobia may be in area when patients alone. When patients alone in the public place. Clear? Okay, now you understand different diagnoses between agoraphobia and panic attack. Panic attack starting in every time, in any place. Agoraphobia only usual when patients alone in a public place, in a large public place, or patients alone outside of their home. Phobia, specific phobia. I pay attention. Specific phobia, it's a name of diseases. Social phobia, it's a name of diseases. Phobia, it's a syndromes. What does mean phobia? Yes, of course, phobia, it's a syndromes when patient has anxiety syndromes. Yes, it's mean autonomous nerve syndromes like tachycardia, like restless, like problems with breathing, like gastrointestinal distress, like restless. It's a problems, body problems. And second, it's a psychological. But psychological, it's a fear, which accompany with what? With accompany with problems in cognitions, like patient decreased cognitions. Patients can think only about stressor. Yes, stressor, it's an object which developing phobia. About the stressor, it's problems, patients cognitions decreasing. It means patients don't see environment, he see only one problems. Patient has problems with cognitions, with attention, and it's very important. Irrational. My opinion, keyword in the situation, irrational. Patient mind understand. It's so stupid, phobia against elevator. But patient cannot do anything. Patient understand. Arachnophobia, phobia of spider, it's very stupid. But he cannot do anything. Patient understand irrational of situations, but patient cannot do anything. Diseases which accompany with these syndromes, which disease in which these syndromes has a favorite place, it's a specific phobia and social phobia. Specific phobia, it's a disease when patient has a phobia against something like about spider, about toilet, about elevator. And social phobia. Social phobia, it's a patient has a phobia against in a public place, in a public event, like an answer, like a take part in meeting, answer in new social situations. Why we split social phobia and specific phobia? Because specific phobia treatment only do psychological treatment. First line treatment, it's a psychological treatment. It's a explosive therapy. And social phobia, patient with social phobia reply to the treatment of the SSRI drugs. It's like a sertraline, like a paroxetine, maybe fluoxetine. Okay, now you understand. Phobia, it's a name of syndromes. Name of disease, it's a specific phobia. It's a social phobia. Next, very important syndromes, it's obsession. What does mean obsessions? Obsession, it's an idea. It's like a gum in the mind. Patients every time think about something. And what's problems in this thinking? Yes, of course, we every time thinking. But in obsession, patient think about one thing, only about one object, and this idea, this idea develop in the patient mind, anxiety syndromes, autonomous nerves problems like trauma, like gastrointestinal distress, like a tachycardia, like a problems with breathing, like a sweatness, and it's a negative body feelings, and psychological problems like fear feelings, like worry feelings. Patients don't like these feelings, these ideas every time developing negative emotions in patient mind. Increase anxiety. Anxiety, it's a negative feeling, so we don't like anxiety. But this idea repeat once more and once more. It's patient cannot do anything with this idea. Clear? I pay attention. It's a syndromes. It's not a obsessive. It's not a disease. It's a syndromes. We can meet the syndromes in other diseases, maybe in schizophrenia, sometimes maybe in the depressions. It's yes, of course. Usually the symptoms depend obsessive compulsive disorders, but it's happy only in situation when patient has obsession, when patient has compulsion, and without other syndromes. Clear? It's like a poor obsessive and compulsive syndromes. It's obsessive compulsive disorders. But if patient has delusion and hallucinations and obsessive idea, it's not obsessive compulsive disorders. I repeat once more. What does mean obsession? Obsession, it's a repetitive idea which developing anxiety feelings. Anxiety feelings, you remember, it's a psychological negative emotions. It's a vegetative symptoms which not so pleasure for patients or our body. Compulsions. Compulsions has a very strong, very close connections with obsessions. What does mean compulsions? It's a pattern of behavior which decrease anxiety, which developing obsessive ideas. Clear? For example, patient every time think about something. For example, patient think about self-harms. And when he, for example, do something, Claras, 1, 2, 3, this idea something decreasing. Now, very interesting questions. What's common between and what's different between phobia and compulsions? First, topics. Obsessions, not compulsion. Obsessions, between phobia and obsessions. What does it mean, obsessions? Obsessions, it's a repetitive idea about self-harms, about aggressions, about some very abstract, like a patient think about damage himself, about damage somebody, about do something negative in some place. Clear? It's something like this. Usual patient never do these things, and it's very distressing for patients. It's developing anxiety. But fear, what does mean specific phobia? Specific phobia much more concrete, and my opinion, specific phobia level of autonomous nerve symptoms, level of fear feelings, much more high, much more high. Next, compulsions. Obsessive idea, something reduced due compulsions. In specific phobia, compulsions absent because anything can't reduce fear feelings. Fear feelings possible reduce only in the very pleasure environment for patients, when patients with somebody which he like, for which he trust, clear. Compulsions level of autonomous nerve symptoms less than in the phobia, in the specific phobia. In compulsions, it's like every time present. For example, patients every time think about like broken the windows, and after that damage himself from the cracked windows. It's a compulsion. Patients has fear against flight. It's a phobia, clear? When patients every time dreaming about what's happy after aircraft accident, about lot of damaged body, about blood, about fire, and this picture, he every time think about, not only in airport, he think about this every time, everywhere. And when he, for example, washing the hand, there is something decreasing. Yes, of course, it's an obsession with compulsions. I hope I explained this syndrome, this phenomena. You remember, I every time said in my lecture, in my briefings, psychiatrists every time try find a biological background of the mental problems. We understand that mental problems, it's problems in our nerve symptoms, but up to the level of technology cannot recognize these problems. Okay, main theory of anxiety. First groups, it's a biological theory. It's yes, of course, are problems in autonomous nerve symptoms. Second, it's problems in neurotransmitters. It's problems in metabolic theory, something wrong in our metabolism, maybe in the sugar, maybe in other things. Carbon dioxide theory, genetic study. Genetic study shows that anxiety disorders has a very strong genetic vulnerability. Twin study and other study and other genetic study shows that in one family, in anxiety prevalent relatives has more high level of anxiety than in general population. Now will be discussed. First, pretendant to the anxiety disorders, candidate to the who develop anxiety disorders, it's a norepinephrine. And yes, of course, we use drugs which stimulate norepinephrine systems. Like anxiety, it's problems in the norepinephrine pathway. Second groups, 5-HT, serotonin. Yes, of course, we use drugs which increase the level of the serotonin, drugs which increase level of the norepinephrine in the nerve systems. And these drugs, usual patients reply to these drugs. Next, GABA. When we use benzodiazepine drugs which influence to the GABA receptors, we decrease anxiety syndromes, and we think then GABA pathway and GABA like neurotransmitters has a very important role into the anxiety syndromes. Next, metabolic syndromes. Something wrong in the sodium lactate. It's like a biological vulnerability. We know then when sodium lactate increasing in our body, it's provoke a panic attack. And some patients has this biological vulnerability. Sodium lactate increasing much more than in other groups. Maybe other problems. Maybe patient has a more high density of the receptors which sodium lactate, which receptors which reduce this. Why it's happy we don't understand. Maybe it's alkalosis, maybe it's hypocalcemia, maybe it's other problems, but we know phenomena. Sodium lactate developing provoke a panic attack. Next, it's problems of the carbon dioxide. We know then increasing of the carbon dioxide provoke a panic attack. And why it's happy? It's maybe problems in density of receptors which reduce carbon dioxide. Maybe it's other problems, but it's a well-known fact. Carbon dioxide provoke panic. In asthma, maybe you know that patients which has asthma very often has excitation. Why is excitation present? Excitation present due to the increasing level of the carbon dioxide in blood. Genetic study. Genetic study shows that very high morbidity in panic attack, in panic disorders, in general anxiety disorders, in some genetic links. Yes. Relative study shows, and panic disorders it's near the 25%, and GAD, general anxiety disorders, in relatives 20%, and in general populations it's near the 2 or 3%. Yes, of course, genetic factors, and yes, of course, genetic. What has been genetic? Genetic, it's something which influences to the gene expression. Genetic, it's our body. Problems in gene, problems in body. But now we don't understand absent specific tests which can say it's a panic disorders, it's a general anxiety disorders. Like this test absent. Diagnosis we take only during the clinical examinations, due to the mental state examinations. Psychological theory, it's a psychoanalytic theory, it's a behavioral theory, it's a cognitive theory, it's a existential model of the general anxiety disorders. Psychoanalytic theory, it's which based off the Sigmund Freud's theory. What does mean anxiety? Anxiety, it's some unconsciousness. Why we have anxiety? Because we have some unconsciousness fear, which we don't understand, but our unconsciousness. What does mean our consciousness? It's our long-term memory. It's what does mean our long-term memory? Our long-term memory, it's a reptile brain. It's a middle brain. Locus coeruleus, it's amygdala, it's memory, long-term memory situated into the one anatomical area. And yes, of course, some psychological idea sent which take fear for ourselves, developing fear feelings. But this impulse is not present in our consciousness, and as a result we don't understand why it's happy. Our reptile brain worry, but our human brain don't know why our reptile brain has a fear feelings. Behavioral theory. This theory, which based in the Pavlov reflex, it's a theory like a phobia. It means, and patients sometimes meet very dangerous situations, and after that, when patients recognize a part of these situations, this situation like a pop-up in hippocampus, in memory, and it's like a flashback, and the starting mechanism of fear, because this is very dangerous for ourselves. behavioral theory, and I pay attention. Roots of majority, maybe of the main all anxiety disorders, it's a combinations between genetic and psychological trauma. Psychological trauma and biological vulnerability, it's like a etiology of the anxiety disorders. When you speak, when you interview patients with anxiety, ask about psychological process. Like situations with behavioral theory has a very good evidence facts in treatment. We use behavioral therapy like expositive therapy, desensibilizations in treatment of the specific phobia. Like we use SSRI and GABA drugs against against other anxiety disorders. And as a result, we think then behavioral theory has important role in the developing of the anxiety disorder syndromes. Cognitive theory. Why we have a fear? We have a fear because our scam of reality incompatibility with reality. We think something dangerous for ourselves, but it's not so dangerous for ourselves. Clear? Some object not so dangerous, but our mind recognizes object like very dangerous, and we every time think it's a dangerous for our surviving, and as a result our body every time jumping in the conditions fight or fly. Our body every time, every minute ready to fight or fly. We like every time ready for struggle for our surviving. Why it's happy? It's happy because we do some wrong conclusions. We do something wrong conclusions. Some objects present in the around ourselves permanently, but we recognize this object like dangerous for ourselves. But if this object situated long time, it means this object not so dangerous for ourselves. And how to treatment? Yes, of course, we use cognitive behavior therapy and cognitive therapy for treatment anxiety disorders. Our treatment, and not so bad result at treatment, evidence fact, and evidence theory. Now we discuss about somatic disorders which can develop anxiety. I pay attention. Patient which has anxiety due anxiety diseases, it's not a mental patient. It's a patient which has anxiety syndromes due general medical conditions. Neurological diseases very often accompany with anxiety, sometimes with depression too. Usual patient which has a neurological diseases very often has mental syndromes. What's mental syndromes? It's a depressions, it's a problems in cognitions. Yes, of course, it's an anxiety like a topic of our lecture. Look to this group of diseases and you understand majority of the anxiety disorder, of the neurological disorders developing anxiety. Yes, of course, we can use psychological treatment, we can use medications for struggle, for improve these syndromes. Next groups, it's systemic conditions, like cardiovascular diseases, like pulmonary diseases, anemia, very often developing mental syndromes, like anxiety and depressions. Very often first expression of anemia, it's a depression and anxiety. Dear colleagues, I refresh in your memory, I repeat once more. Before mental state examinations, we do clinical examinations, because majority of the mental syndromes a patient has due general medical conditions. Endocrine disorders, yes, of course. We never think about mental disorders without very completely clinical examinations. Patient has anxiety, MRI, blood analysis, biochemistry analysis, everything. You must remember that majority of the somatic diseases developing mental syndromes. anxiety, depressions, maybe delusions, hallucinations. Today we speak about anxiety. And now you see that majority of somatic disorders developing anxiety or accompanying with anxiety. Inflammations, yes, of course. Rheumatoid arthritis, polyarthritis. A lot of diseases include anxiety, like syndromes. Yes, of course. For treatment these patients, we can prescribe anxiolytic drugs, but in these patients, main strategy is reduce main diseases which developing anxiety. In general, all kind of diseases which influence to the patient's lifestyle, developing depressions and developing anxiety. Intoxications, yes, of course. If patients has intoxications due illegal drugs or due some toxin, very often he has anxiety-like syndromes. And sometimes if you not recognize anything in clinical examinations, you must think about toxicological examinations. Thank you very much for your attention. I am Professor Dvirsky Alexander. Now come back to the stream. Dear colleagues, I hope now you listen me. I think lecture was clear for you.